If I do say so myself, women are powerhouses. We take care of so many things like
working and taking care of family.
So sometimes we may forget to take care of ourselves. But today, we're changing that by talking to integrative gynecologist Dr. Tara Scott.
I'd love to discuss the top 3 issues that women face and how to really focus on prevention.
First up, Dr. Tara is discussing breast cancer.
The number 1 cancer in women is breast cancer.
So Dr. Tara says awareness and prevention are imperative. She recommends
decreasing the plastics in your environment, simple things like reusable water bottles instead of the disposable water bottles, or changing your Tupperware from Tupperware to glass Snapware. Those plastics are what we call endocrine disruptors,
which Dr. Tara says are chemicals that act like estrogen in our bodies, which can lead to an increased risk of cancer. And besides ditching plastic, she says our diets can play a huge role.
There is a recent study that just eating a little bit less meat and more poultry has been translated to a decreased risk in breast cancer.
As well as adding certain foods into our diet like
cruciferous vegetables, cabbage, broccoli, kale. Blueberries are really great antioxidants, and fiber. A lot of people don't eat enough fiber. All of those are going to really add at both the cellular detoxification of estrogen and also the elimination in your gut.
Next, we're talking heart disease.
I think as a whole, we do a great job being preventative, looking at cholesterol levels, looking at sugar levels, but many women don't realize that estrogen has a link to heart disease.
As for other hormones to be aware of,
vitamin D, often thought as a vitamin, is actually a hormone, and low vitamin D has in addition been associated with an increased risk of heart attacks. And finally, testosterone.
So she recommends we work with a hormone specialist to regulate our hormone levels and practice stress management.
Things like getting enough sleep and definitely yoga can reduce cortisol, which is associated with increased cardiac risk.
Finally, let's talk osteoporosis prevention.
1 out of 3 women are affected by osteoporosis. Osteoporosis is a thinning of your long bones. That is the strength of the bone that thins and makes you at higher risk of fractures.
So she recommends we take steps to combat it.
Making sure that weight-bearing exercise is part of your normal routine. So walking counts, running counts. It doesn't have to be running a marathon, but anything that has you putting weight on your long bones.
But don't forget your top half. So she says work on your arms as well. And certain minerals we can take like
strontium and boron. So there's a lot of good bone health supplements out there that can also be helpful.
Getting ahead of things with women's preventative health tips is on top of the list.